Hello, my name is Ryusei Nemoto. Thank you for seeing my presentation. The theme of my presentation this time is obesity. I will explain what obesity is like. Please listen to the end. I would like to explain the current flow. First, I will talk about the definition of obesity. I want you to understand about obesity log theory. Next, I will talk about the case of obesity. Third, I will tell you about the risk of obesity. Finally, I will teach you how to solve obesity. This is a logged flow of this presentation. From now on, I would like to talk about obesity. What is obesity? How do you reply when asking what obesity is? If you do not know much about obesity, I think many people think it is obese if it looks fat. However, obesity has a definition. In Japan, BMI exceed 25 is considered obese. I decided to be over 13 in the world. A thing called BMI came out. I think that some people do not know about this, so I will explain. BMI can be expressed by the above equation. I understood what kind of expression, so let's put in a value suitable for testing. Weight is 16 kg. The height is 117 meters. I put these two values 16, 1 to 7, 1 to 7, 20, 10, 7. The BMI is 25 or less. So I can see that this person is not obese. And this way it is easy to find out if you are overweight or not. Please try with your height as well. Case of obesity. I think that you understand the definition of obesity. Next, I would like to talk about the case of obesity. There are three main cases of obesity. The first one is a bad meal. The second is lack of exercise. The third is stress. I would like to talk about these. First of all, I would like to talk about bad eating habits. There are three concrete examples of bad diet. One thinking is that you do not have breakfast. Another thinking is that only you eat out. Third, to have late night snacks in the middle of the night. I am going to keep such English eating habits to match such lipid and sugar. Afterwards, the energy increases exceeds energy consumption and accumulates for saving. Therefore, fat and so on will increase. It will approach obesity. So bad eating habits lead to obesity. Next, I would like to talk about lack to exercise. Internet and cars have become widely used in recent years. You can use less energy to move your body. Therefore, energy intake exceeds energy consumption, leading to obesity. Therefore, it can be seen that lack of exercise leads to obesity. Finally, I would like to talk about stress. As stress increases, cortisol and other hormones increases. Therefore, the hormonal balance collapses. Cortisol has the function of raising the blood sugar level. Therefore, the blood glucose level raises. Insulin is secreted to lower it. Insulin tries to lower sugar level by storing sugar in fat, so it accumulates fat. If cholesterol selection is too high, serotonin will not function. Serotonin is a hormone that suppresses appetite. Therefore, it increases appetite and leads to obesity. In addition, cholesterol turns music into sugar. Thus, insulin is secreted, leading to obesity. Stress leads to obesity. Risk of obesity. At first, it is a burden of the mind. The second one is the burden on the knees and waist. Third is sleep apnea syndrome. The fourth one is my lifestyle. Finally, it is time to talk about gynecological disease. First of all, I would like to talk about heart attacks. When becoming obese, the capillary vessel also grows as the body gets bigger. After that, the heart will send blood further away and will shrink the heart. It also increases the risk of accumulating dyspepsia and progression of arteriosclerosis. Next, I would like to talk about my foot. When walking, the bottom of the king will be 2 to 3 times the weight. Obesity increases the burden on the skin and waist, including causing skin osteoporosis. Next, I would like to talk about sleep apnea syndrome. One of the cases of sleep apnea syndrome is the narrowing of the airway by the fat around the neck. Sleep apnea syndrome is often called snore. Next, I would like to talk about lifestyle disease, conditions that cause version lifestyle-related disease such as hyperglycemia, hypertension, hyperlipidemia, obesity, and the like. These can cause obesity. Finally, I would like to talk about gynecological disease. There is a survey result that ovarian cancer risk increases as obesity increases testosterone hormone levels in blood. Finally, I would like to talk about the solution of obesity. Here, I would like to provide 5 solutions: diet therapy, exercise therapy, medication therapy, sugaring, mental health. Here are 5. Let's see each one. The first one is diet therapy. First of all, it protects calorie intake so as not to exceed the caloric expenditure. The second is to eat the idea of natural balance. Third, refrain from eating out. The fourth thinking is to be careful not to eat instant foods as much as possible. If you follow these, you can solve the obesity. The second is exercise therapy. By incorporating aerobic exercise and resistance exercise into our daily lives, we promote fat burning. An example is practice such as running, walking, sports, etc. Exercise therapy is said to be a body that is difficult to rebound. Exercise therapy can also eliminate obesity. The third is mental care. This is a therapy to prevent and eliminate stress indicate obesity. For example, doctors' counseling can be maintained. You can prevent obesity by correcting hormonal balance problem caused by stress. It is also difficult to rebound. Therefore, spiritual care can solve obesity. The fourth is surgery. It is a method of removing fat and cutting out a part of the stomach. By physically restraining the activity of the stomach, it can prevent digestive absorption and reduce intake of meals. For example, sleep gastrectomy, stomach binding, gastric bypass grafting, cerebral bypass grafting, and the like can be maintained, so you can solve obesity. The end medical therapy. Treatment to eliminate obesity while prescribing an appetite suppressants or Chinese herbal medicine, having a high metabolic promoting effect. It is also a way to make it easier to lose weight. For example, Macedonia Zenical Orlistat, metformin, Chinese medicine, Meridia. Rebounding is easy, so you can solve obesity. Up to now, I have talked about obesity. When you become obese, it is pretty bad for your body. Considering the risk of obesity here, I think that it is desirable to eliminate it at an early stage. When becoming obese, I believe that obesity can be solved by trying versions solution by referring to the obesity solution listed here. I think that I can prevent it. I think that it is most important to settle before becoming obese. Thank you for your attention. I am pleased that this video lends to obesity prevention and obesity restoration. I really appreciate you.